So welcome back, you guys. We are going to talk about the rewind time treatment today. This is the third session of our webinar series this season. So thank you for joining me as always. As a lot of you guys know, we've talked about rewind time a couple times in the past, but I really want to delve deeper into this treatment. It consists with a lot of different lasers, but we can use it on the face, neck, and chest. I want to kind of cover all of that today. So for those who don't know me, I should honestly take this slide out at this point because I know you guys are pros, but I am Dr. Lisa Ishii. I joined Dr. Cox and Aesthetic Solutions in 2 years, or coming up on 2 years actually, and you guys have been just so wonderful welcoming me, so thank you as always. So we'll get started here, but let's first start talking about the aging face. So the aging face, I actually like to think about it in 4 different layers. The first layer is bone, and the second layer is fat, third is muscle, and fourth is the skin. So in terms of something like bony structure, fatty structure that shifts and changes with time, we like to rely on things like hyaluronic acid, gel-based volume support, and fillers, and biostimulators like Sculptra and Radiesse. For the muscle, we like to use something like a neuromodulator, Botox, Dysport, Jeuveau, things like that that helps modulate or help prevent those muscles from working against us. And then finally, where I really want to shift our focus today is the skin, okay? So one of my passions and goals is to make sure that our skin quality matches with the bony structure and architecture of our face, because what we want is a holistic and natural result. So what do I mean by skin quality? So skin quality is actually a pretty broad term that covers a lot of different things, and it covers both things like texture and coloration. So when I'm talking about texture, I'm talking about like the skin thinning. Everything just looks kind of thin and like crepey. Etch lines, so even lines at rest that we start noticing, especially in areas like around the mouth. We have that kind of cobblestone appearance or change around the mouth that I always refer to, and that has to do more with sun damage, okay? In terms of coloration, we can talk about things like redness, blotchiness, kind of that like a ruddy look that some of us get, specific vessels, for instance, that pop up on the side of our nose, and then things like brown spots, which are like sunspots, freckles, people call them liver spots, and so forth. So all of these things combined make up what I refer to as skin quality. And then all of these things are caused by both intrinsic aging, which is more genetics, and extrinsic aging, which is things that we come across from the environment. So things like sun damage is the most common, but other environmental factors such as smoking or pollution and so forth. And I always say you can't neglect the neck, and you really can't neglect the neck or the chest either, honestly, because really when we start focusing on skin quality of just the face, then our neck and chest aren't keeping up. And the neck and chest and the body actually undergo very similar aging processes. And historically, I'll tell you that from personal experience myself, you just don't think about taking care of the neck and chest until it's too late. So really when we start talking about rewind time and what it can do, you also want to talk about addressing the skin quality changes of neck and chest as well. The key thing about rewind time is we're able to reset all these skin quality changes that we were finding with the intrinsic and extrinsic aging process. And we're able to really reset, rejuvenate all of these common issues. So let's dive deeper into what exactly rewind time consists of. So I actually combine anywhere between 4 and 6 different lasers on the same day to truly reset the skin. So we'll kind of talk about these lasers a little bit individually, but to give you kind of an outline, I use the V-beam laser that helps with redness, vessels, those little spider veins or broken capillaries that we get around the nose. The Q-switch Alexandrite laser targets individual discrete brown spots, those liver spots, those sunspots, the little freckles, things like that. And then the fully ablative CO2 and erbium lasers are really what helps with that texture, some tightening, things that we use lighter lasers to try to address, but may not address in full. So when I say skin quality there, I'm talking more about skin texture. Now, for those who also want to reset the neck and the chest, I will add in 2 additional lasers. For the neck rejuvenation, I use a fractionated CO2 laser. And for the chest, I use the Fraxel dual laser. And I, of course, combine this with the redness laser, pulse dye or V-beam laser, and the brown spot laser, Q-switch alexandrite laser, as needed to address all of those concerns. So a lot of you guys that are very in tune with our practice is probably scratching your head wondering, okay, why are we combining all these lasers? I've done V-beam before, I've done Alex before. Why combine all of them? So as you saw in the last slide, each individual ones of these lasers are really, really good and really specific at targeting one thing. So redness or telangiectasias, brown spots, texture. But in order to get a holistic reset of the skin, again, you want to target all of those skin quality changes that I talked about earlier in order to really get a holistic and natural result everywhere. You don't want perfectly smooth skin with a bunch of red blood vessels. You don't want perfectly smooth skin with all these little brown spots. You want a holistic result. And that's why I like to combine the lasers so I can really get you to your goal and to kind of get you that natural, holistic look. The key thing about rewind time, additionally, is because it's a little bit of a more dramatic procedure, for those who are looking for a, say, like one and done procedure, this is going to be a really nice laser for you. It is certainly not a series of treatments. It's going to give you a reset with this one go. So let's talk about who is a good candidate for this. Typically, I reach for this for people with moderate to severe sun damage. So if you have some mild sun damage, other lasers or one of the lasers that I use in the rewind time will be able to address it. So I look for people that have a little bit more substantial sun damage that may have used something like the Fraxel or the Halo or something in the past, and you just want to take the next step. You want to turn it up a notch. I also reserve it for people that want a really dramatic result but may not be ready for surgery yet. So I'll actually show you a little bit later in the photos, but I can get quite a bit of tightening around the eye. So, if you're someone that's been thinking about getting eyelid surgery, but you're not quite there yet, and you're okay with the modest results, then this is a great laser to kind of help tighten that area up. On the contrary, there's a lot of people that actually come to me either before or after their facelift procedure to get their skin on par with what their facelift results are going to achieve. So like I said, we want facial architecture, the shapes, the fullness, the tightness to match the skin quality. So for those who are getting ready to do their facelift, but they do have moderate sun damage, you might come to me, do this procedure, really clear up some of those skin quality issues before pursuing your facelift, or vice versa. And like I mentioned earlier, if you are someone that is a career person that just can't come in for multiple treatments, you might reach for this for more of a one and done approach. So let's talk about the individual components here. So the first off, let's talk about V-beam. So a lot of you guys have had V-beam before. I have too, and that is really to help with those discrete telangiectasias and the redness. Also, you might hear me call it like the pulse dye laser or PDL. That is all the same. And this is specifically used to target blood within blood vessels. So when we target that blood, heat it up with the laser, you're actually able to close down those blood vessels that are accessory on our face. Okay. Also really good for that background redness, which is, a little bit more frustrating. You come out of a hot shower, you come out from working out, and you look in the mirror and you say, oh my goodness, why is my face so flushed? The V-beam laser is really good for that as well. Kind of evens out the skin tone so you don't look quite as ruddy. Okay, so this is one of patient of mine that I did the V-beam laser on. She actually underwent a series of treatments, but she had the V-beam only. So again, not rewind time, just the V-beam. But I wanted to show you guys what the V-beam alone can do. Next up is that alexandrite laser. That is your discrete brown spot laser. The target is melanin. So things like freckles, sunspots, the liver spots, and again, helps even out the skin tone. Same thing, I'll repeat myself, this person only underwent the Alex laser, not the full rewind time, but you can see just how much of a difference the brown spot laser can make. And of course, the fully ablative CO2 and erbium lasers that's working more on skin texture. So I want you to look at the photo here on the left of the area around the eyes. This is what I was talking about when I can tighten the skin with the laser. This is not surgery, I'm not cutting, I'm not doing any of that, but even with the laser by itself, I can get a lot of tightening and tautness of the skin that something like, say, the Fraxel or the Halo can't quite achieve. And you can see here, just by undergoing the rewind time, and these two women in this photo actually did undergo the full rewind time, you can see just how much better that skin looks. Now shift your focus on the photo on the right here. You can see she actually called them her barcode lines. I thought she named that very well. And a lot of people have this. It's really, really common. And part of it is actually hereditary. Part of it's just movement inspired. So if you're someone that drinks out of a straw or just purses their lips as a habit, you might start noticing these things develop. But you can see here, just with one treatment of the rewind time, we have really reset that skin. And a key thing too is that, with someone like this person on the right, relying on injectables alone just wasn't going to get her the dramatic result. Now, if you look at her after photo, she has a couple of those lines left, but now we have a realistic baseline to start with to add in something like an injectable to really augment and make a difference. So the neck, I reached for that fractionated CO2 or the Fraxel repair for the neck. And instead of fully vaporizing the skin tissue like the fully ablative lasers do, you're actually inducing controlled columns of vaporized tissue. Okay, so you heal a little bit faster than that fully ablative treatment. This is really nice because it's going to help with the skin texture. Again, it's going to help lift up some of that pigment and help with those kind of fine lines. Okay, I do want to mention that it does not do anything for fat reduction. So it's not going to take away like a double chin or anything like that. So I keep that in mind. But again, even with this before and after photo, you can see that the neck skin is just so much smoother. And it matches with that nice improvement we got on the lower half of her face as well. And then, of course, the Fraxel dual laser for the chest rejuvenation. Same thing, induces collagen remodeling and evens out the skin tone, decreases the appearance of sun damage, and helps with those fine lines. So let's kind of start going through some what to expect here. So on the treatment day, this is a little bit of a longer treatment day. So I always tell my patients to expect to be there either full morning or full afternoon. It's not like we're going to be lasering that entire time, but I actually use injectable numbing to numb up the face and the neck. I do topical on the chest, but I do injectable numbing that always takes a little bit longer, but I want to make sure you guys are comfortable. So by the time we do the numbing, by the time we give you some extra medications, if you do request them, something like Ativan or Vicodin, a little bit more of a stronger sedating medicine, then by the time we do all that, it ends up being a full morning or a full afternoon, so plan on that. If you do end up selecting to take a little bit more of the sedating medicines, you will need a driver. And because I go right up to the eyelids, like you saw me tightening up the eyelid skin, I do put metal contact lenses or corneal shields into the eyes to protect the eyes from the laser, okay? After I place those contacts is when I do the injectable numbing. Face, neck, the chest, like I said, is topical. It's the stuff that you guys are used to. And then we let the topical sit while I go ahead and start on the face and neck. So I know you guys are all wondering what the healing and the downtime is. We'll talk about that, and I am honest about this. It is a little bit more of a dramatic downtime, right? Dramatic results equals dramatic downtime. 2 weeks. You're bloody, you're crusty, you're doing wound care at home every 2 hours while you're awake. And when I say wound care, I mean things like dilute vinegar soaks and a very specialized wound care regimen that I will teach you how to do before we do the procedure. In fact, you'll be coming to the office to see me every couple of days so I can make sure that everything is healing well. There's no signs of infection, everything like that. Now, once the skin heals over, you are going to have prolonged pinkness or redness that can actually last up to 3 to 4 months, okay? Once the skin is healed over right around day 14, I do let you start wearing like a nice tinted sunscreen, a light mineral makeup so you can cover up that pinkness, but pinkness to redness is normal for quite a long time, 3 to 4 months, okay? Sometimes if that pinkness is a little too dark, I will enlist the RewindTime Laser, our old friend, to help us continue to decrease some of that redness a little bit faster. The neck and chest also undergo a slightly different timeline of healing. The neck, you're going to have a little bit of redness, some ooziness and scaliness that'll last around 10 days. It's going to heal a little bit faster than the face. The chest, there's not going to be any ooziness or bloodiness, crustiness, but you're going to have more of like a redness and a coffee ground scaliness that may last a little bit longer, so 2 weeks. Okay, so this is my warning slide to you. I'm going to show you healing photos for the face. I'm showing you this because I like to be honest. I want to show you what to expect, but again, it's a little bit graphic, so proceed with your own risk. That was your warning. All right, here we go. So this is what people look like. Again, I'm not showing this to scare you. I'm showing this because this is truly what all of my patients look like, and this is normal. So like I said, I'm vaporizing layers of skin tissue off to give you that amazing smoothing and that texture rejuvenation. So the first couple of days, that first one is day 1 day after the procedure, you are swollen, you're scaly, you're oozy, you can see that. As part of the skincare or the wound care regimen, I actually have you put an ointment over the face, which is why she might look a little bit greasy. The next photo is day 3. So you can see that a lot of the swelling has gone down. She's of course still swollen. She still has an open wound on the face, but things are looking a lot better. Now things progress all the way to day 14, which is what you see all the way on the right. And you can see that the skin is now fully healed over. She might have a couple of areas of kind of that darker sandpapery crust, but you can see that the skin is fully healed over. But look how red she still is, and that is normal. When I go through before and after photos later, I'll actually show you what someone might look like at like the week 4 mark, so you can see just how red people still remain. So good job for looking at that photo. You have survived the scary photo. So let's talk about how to prepare for optimal healing. So typically what I do, if you don't already or aren't up to date on your neuromodulators, so something like Botox, Dysport, Jeuveau, I actually will do that at your preoperative visit 2 weeks before. So even if you're someone that doesn't routinely get neuromodulators as part of your skincare plan, I usually do recommend doing it at least right before the procedure because I can't be having those muscles yanking and pulling as you heal. So I always do offer that. I can't force you guys to do it, but I do offer that to help with the healing process. I teach you in depth how to do the wound care. In fact, we have a little QR code that you get to scan when you go home that actually goes through a video of how to prepare and do the vinegar soak. I do typically prescribe you an oral antibiotic and an antiviral medicine so we can decrease our risk for infections. I always tell my patients to have clean sheets, clean towels, ready to go at home. So when you are healing, you're not scrambling to do laundry, things like that. Now, the next part is what people get really sad about. And I actually don't let you have your pet in the same room as you recover. Because pets, you know, I have a dog. I love him. I always put my face in his fur. But if you think about it, pets lick their butts, they lick their fur, suddenly you're touching their fur, you're touching your face. It is a way to get an infection. In fact, some of the worst infection cases I've unfortunately have had to deal with are people that decided that pets, they just couldn't stay away and their pets ended up like sitting on them or, you know, like they put their face in their fur and that's how you get infection. And I'm really strict about it. I love your pets as much as you love your pets, but your pets have to stay outside of your room while you are healing. And of course, in the same vein, you have to limit exposure to the elements. So no gardening, no working out until the skin is fully healed. I know all of you guys love going on walks, but you can't do that until, again, the skin is fully healed. Obviously, just like any other lasers, you have to avoid the sun. You just can't be, quote, careful. It should be sun avoidance, okay? And then for those who undergo this procedure, I always say, listen, text or call me if you're not sure. You guys get my personal cell phone number, and I always make sure that you guys know that if there's any questions at all, I'd rather you text or call me or call the office rather than you wondering at home whether something looks right or feels right. So let's go through some side effects here. So like I said, and like you saw, swelling, bruising, redness, bloodiness, crustiness, that is all to be expected, okay? That is normal. That long-term redness that may last up to 3 to 4 months, that is also normal and to be expected. Now, we briefly talked about infection already. We always like to minimize that risk by having you take those antivirals, the antibacterials, and of course, doing the wound care at home. Now, some getting into kind of more rarer side effects are things like hyperpigmentation. Again, if while you're still red or healing, if you get hit by the sun, instead of the skin healing nice and smooth and your normal skin tone, it might actually darken. So that's why I'm really cautious about the sun. Now, something that's really rare, but I have seen happen, is something called delayed onset permanent hypopigmentation, which means that this happens actually like months after we think you're fully healed. You look in the mirror and you say, oh my gosh, why is my skin looking a little bit blotchy and pale? So that's the example I'm showing you here. This is not my patient. This is actually published in an article because this has been reported, is that the skin just kind of loses its color. And people don't know exactly what causes this. We think it's because the heat and energy from the laser actually makes the melanin producing cells a little bit lazy, and they just stop producing pigment. This is oftentimes permanent. It is very hard to treat. There's some tools that we have that can help with the treatment, but like I said, this can happen. It's rare. And of course, the fear complication is scarring. That is why I see you back in my clinic every couple of days so I can make sure things are looking good. You don't have any questions about the wound care. There's no signs of infection because this is what I'm trying to avoid at all costs. And of course, we have to protect the investment. So, once you get this, like I said, this is more of a one and done laser. So we want to make sure that year after year after year, you're going to protect that investment. So, you might, if you're someone that's motivated and you want to continue doing maintenance treatment, you could always reach for something like the Fraxel, the Halo, even a combination of the BBL and Clear and Brilliant to maintain these results year after year. Usually I say 6 to 12 months, but typically most of my patients elect to wait a full year until they start doing maintenance treatment. And of course, medical grade skincare is the homework at home. I always give you my recommendations throughout the healing process and even after your treatment to make sure that we are doing everything that we can to augment and maintain those results. So now is the fun part. I get to show you guys some photos here. So you already met, these are all friends that you met throughout the presentation, but you remember this patient of mine, beautiful patient, wonderful bone structure, but she was noticing the area around the eye, the area around the mouth just wasn't quite keeping up. So we did the full RewindTime Laser on her, and you can see that the area around the eye, of course, like we talked about earlier, has tightened up big time. That cobblestone appearance around the mouth blends a lot better with the surrounding skin. And this is actually a very interesting point, is that if you actually look at her lip border, you can see that the lips look a little bit more defined as well. And I'm able to achieve that because when I do the laser, I actually laser right over the lip. In another angle here, you can see that the brown spots are gone. She is right around the 3-month mark in the after photo. So you can see she's still a little bit pink over the upper eyelid. And I think you guys can see that there. And this is the photo I was referring to earlier. So even if she's around 4 weeks out at that second photo, and you can see just how red she is. And this redness is normal, it's to be expected, and can persist for about 3 to 4 months. And the following year, this patient actually decided to do the neck with me. So you can see just how much better her neck looks with one treatment. That was with that Fraxel repair. And this is our other patient that we discussed earlier. She coined the term barcode lines, and you can tell just how much better she looks here in the second after photo. And she's also around, I would say maybe 2.5 months out, and you can see she's still a little bit pink, and you can see that particularly around that upper lid there. You can see that the brown spots on the right side of her face, I guess left if you're looking, but right side of her face just looks a lot better. And they're not nearly as distracting. Skin is even tone. She just looks much more refreshed. And this patient here. So you can see, again, she's someone that was really bothered by the cobblestoning around her mouth. She had some of those brown spots kind of over the forehead and that kind of creepy skin around the eyes. And you can see that with the RewindTime treatment, she just looks a lot better. She had that blotchiness that I was talking about around her nose as well. And you can see that the nose also looks much more even in skin tone. And this is another patient of mine. She was really bothered by, she has more fine line around the mouth, right? But she still bothers her. It's more kind of crepiness around the mouth as opposed to the deeper barcode lines. But even that, you can see that it can make a beautiful difference. And the area around the eye, again, that crepey, thin skin, we're able to tighten up. So it just looks a lot more supple. And finally her. So she is someone that had a little bit of both. So she had a little bit of that kind of laxity of the upper eyelid. She wasn't quite ready to undergo blepharoplasty or an eyelid surgery. She was worried about the brown spots over her cheek. And of course, she has kind of those fine lines around the mouth that she wanted to address. And we addressed all of the above. You can see that, again, look at her lips. See how the lips actually look a little bit fuller. So this is because we lasered over the lip and we rejuvenated the lip. The lip ages just like the rest of our face. So even without any injectables, we were able to give her a little bit more boost over the lip. And then I will turn to some questions here. I hope that was helpful for you guys. I know it's an intense procedure, but I'm hopefully able to kind of illuminate it a little bit here. So I have a few questions here I'll go through. First question is, what does the treatment feel like after numbing and medicine? So with this, that's a great question, and I get this question a lot. So even with that injectable numbing, even with that extra medicine, you will still feel the laser, and that is normal and to be expected. In fact, a lot of my patients' feedback is there's certain areas where you actually don't feel it at all. There's certain areas that are actually a little bit spicy. For those spicy areas, it's still very tolerable. All my patients tell me that. For whatever reason, if it's not tolerable, the great thing is that you are awake. So you just say, Dr. Ishii, I just need a little bit more numbing. And I say, oh my gosh, I'm so sorry. And I just add a little bit more numbing. Very tolerable procedure, especially since I do the injectable numbing. The next question is, how long will the results last? So, that's also, you guys are really good with the questions here, but also a really nice question. If we want to maintain these results over the long term, my recommendation always is to do maintenance treatments. And that could mean things like the neuromodulator, something like Botox to continue to help relax those lines so they don't have a chance to etch back in. That laser, maybe once a year, something like Fraxel or Halo, something much lighter that you might do once a year to build upon those results. For those who do that, you can get results over a long period of time, okay? Now, for someone that says, this is my one and done, now I'm gonna go back to all of my habits, I'm not gonna wear sunscreen, I'm gonna go outside, not photo protect, then those results might not last as long. But even for those patients who decide not to do any maintenance treatment, don't avoid the sun, don't do medical grade skincare, this result will last you a couple of years. Okay. Cost. So cost, I actually build you a quote at your consultation because depending on how much I see, how many lasers we have to combine, everything like that, I will tailor the cost to you. Great question. If just the neck is done, would a driver still be needed? entirely up to you. If you do decide to take a little bit of that more, the stronger medicines, then you will still need a driver. If you just decided to do the neck though, and you said, you know what, I'll just get through it with just the injectable numbing, which is very much possible. In fact, with the neck, just the neck, I rarely need to use anything stronger. You will not need a driver. And then last question here, how do neck treatment results compare with RF microneedling? So this is a much more dramatic laser, and therefore it's going to give you more dramatic results. But that being said, it's going to be a slightly longer downtime. So with microneedling, you might look a little bit pinpoint bleedy, pink, and a little bit puffy for maybe 48 hours or so. Then you might kind of go into a little scaly phase. This one's going to be a lot more intense, and there's going to have that wound care involved. So 10 days where you're going to be looking a little bit oozy. You might see that kind of bloodiness, crustiness, and that wound care every 2 hours is going to be involved. So it's going to be more dramatic results, but of course with more dramatic downtime. If someone comes from out of town or is out of state, how long would I need to be in town? So typically what I recommend for this is that so usually how I do it is let's say I do the procedure on Monday, I always have you come back to see me the next day so I can make sure that you don't have any questions, the first day looks okay. And then usually I have you come back on day 3 or 4 after treatment. Typically I do this procedure on Monday, so before you go into the weekend, I always like to lay eyes on you to make sure. A lot of my out-of-town patients will stay through that 3 to 4 day mark. At minimum, depending on how far you're coming from, I would say all of my out-of-town patients will at least still stay through that next post-op day 1 appointment, just so you don't have to drive back and forth in such quick succession. But that's a great question. In terms of follow-up, just to be a little bit more specific, I see you back the day after procedure at day 3, 4. Then I have you come back maybe a week after the procedure, and then another time that same second week. And then I can space things out. So usually I have you come back at a month, maybe then 3 months. So that kind of that first 2 weeks where it's that biggest downtime is the time where I'm really seeing you a lot. But in terms of out of town, depending on your flexibility and depending on how far you're coming, usually it's that first day that most people will stay through. Another question here, if you wanted results for the holidays, is that possible or is it too late in the year? Great question. If you want to look fabulous by the holidays, I would be thinking about this procedure like now, because again, remember, you're going to be red, you're going to be pink for at least 3 to 4 months. Now, when you get close to that end of that 3 to 4 months, most of my patients are just kind of pale pink, like you saw in some of the before and after photos I showed you, which is easily coverable with makeup. Most patients don't even really feel like they need to wear makeup. So really you need to start thinking about it now, not to throw that and jump that on you, but because, again, I'm really honest about the downtime, that redness for 3 to 4 months is very, very real. And then the last question here, completely avoiding sun for 4 months, question mark. So I will tell you this, at that 14-day mark, I am letting you wear sunscreen, okay? The reason why I preach sun avoidance the first 14 days is because when your face is an open wound, I don't let you put on sunscreen. I don't let you go out into the elements. So really, it's like absolute true sun avoidance that first 14 days. Now, at the 14-day mark, you're still very much red. And like I was saying, if that redness gets hit by the sun, you have a real risk of that redness darkening. Now, I have tools in my toolbox to help lighten darkening, but that's like that's like creating a new problem that we would rather not have to deal with. So, as long as you're really careful, you're wearing your sunscreen, you're wearing your hat, you're doing all these things, you're reapplying, then I'm okay with you slowly kind of going back to your normal life after 14 days. But if your normal life is going to play tennis every single day in high noon, I'd probably say, well, try to wait until that redness has faded a little bit more so we can decrease your risk for something like hyperpigmentation. Another question here, is it cheaper than a facelift? So I can't speak for our surgeons around here. I just frankly don't know the pricing, but it offers completely different results. So like I said, a lot of people will combine it with a facelift per se if they really want to get a holistic look. I will say, it's something that, in terms of skin rejuvenation, there is nothing matched compared to this because I can really, really help rejuvenate the skin and truly reset. So I can't speak for pricing compared to a facelift, but if you're someone that's trying to hold off a facelift per se, and you want to kind of get that lifting around the eyes, a little bit of tightening over the cheeks and whatnot, I can achieve it with this laser. But you guys, thank you for coming. This means so, so much. This is always so fun to get to hang out with you guys. So if there's any questions, give our office a call. I'd be happy to see some of you guys in consultation so we can chat a little bit further. And I hope you guys enjoyed today. Thank you guys so, so much. You guys have a good rest of your week.